All right, welcome to video number 2 in our interview welcome series. Again, my name is Sam Lozier. I am the IM program director here on Ascension St. Vincent in Indianapolis. And I wanted to talk with you a little bit more about our curricula, about our research, and about our fellowship opportunities. So launching first into information about our curricula, we are on what's called an X+Y model. And for us within our program, it is a 4+1. Meaning you will do 4 weeks of a block rotation, whether that's inpatient wards, ICU, or selective, cardiology, etc., followed by a 1-week block of ambulatory medicine. For our curriculum across the 3 years that you'd be rotating with us is laid out here, whether you're a categorical resident or a primary care track resident. You'll note for categorical and primary care track in PGY 1 year, it is very similar, but there are some deviations that I'll elaborate more on here in a little bit for the PGY 2 and PGY 3 years of training. For the most part, to give an example, just to walk through this for the PGY 1 year, each resident will do 14 weeks of inpatient medicine wards. So that comes down to 3 4-week blocks plus a 2-week block throughout the course of the year. You'll also do 1 4-week block of nights, 1 4-week block of cardiology, 1 block of ICU days, 1 block of ICU nights, 2 blocks of selectives or elective time, and then 2 weeks of clinic chief time. I'll elaborate more on that here in a moment. Our Y weeks are broken up by half day. Throughout the 5 days of the week, you'll have 10 half days. About half of them usually are continuity clinic time, where you're within the residency clinic seeing your own patients. The other remainder of those half days are broken up between subspecialty clinics and administrative time, as well as didactics when appropriate. So Wednesday afternoon alternates between academic half day and administrative time. This is just a sample schedule. For administrative time, the goal behind that is really to provide time in order to complete tasks that we know that you have to do, whether that is work-related, things like calling patients with follow-up results, getting assignments done or modules completed, or just doing some extra studying with some extra study time, as well as life things. So going to the dentist and getting your oil changed and things like that. We want to make sure you have some flexibility during those bi-week schedules to get some other things done that we know, especially you probably can't do when you're on busy ICU or busy inpatient ward rotations. Our inpatient ward rotations, we actually call AIMS. It stands for Adult Inpatient Medicine Service. So if you hear people talking about AIMS, that is what we mean. We are a high acuity tertiary quaternary referral center, and so we have a lot of high acuity patients on our medicine service. We care for sick, complex patients, and we get a lot of referrals throughout central Indiana sent to us. Our AIMS is built up of 8 teaching teams, 5 of which are the traditional team where you have an attending, a senior, 2 interns, and then medical students. But in addition to that, we have 3 what we call advanced teams. These are primarily built with an attending and a senior. Occasionally there is a medical student or an intern on those teams, but they often work directly with the attending. The goal for those teams is that the senior gets some advanced experience as a hospitalist without necessarily having to oversee the whole teaching team. Our facility is built on accountable care units. So these are geographical model units. They include things like progressive medicine, general medicine, hematology, oncology, cardiac units, etc. So each of your AIMS blocks will be within one of these geographical units, and the goal being that you get experience across all of them over the course of your intern year and beyond. Our teaching team targets are about 15 patients, and currently our call rotation features call every 4 days. Typically when you're on call, you get up to 3 patients as a team, but often each learner gets 1 patient admitted during call. For our ICU, again, we are a high acuity system with a lot of complex patients, great pathology to learn from. Our ICU includes medical ICU, CVTU, trauma neuro ICU, and a burn unit. Our residents primarily rotate through the NICU, but there are elective opportunities in the others. Our ICU is robust with options for ECMO. We do kidney and heart transplants. We're a level 1 trauma center and a stroke center of excellence, so you'll see a lot of high acuity patients here. We do lots of procedures. I'll talk more on that in a little bit. As well as we have 2 ICU teams that run the medical ICU. And again, our target is about 15 patients or so. For procedures, we did over 2,300 procedures as a residency last year alone. This is something that we're really proud of, the residents' experience with doing procedures. And really, this is inpatient and outpatient procedures, I wanted to add. So all residents will get very comfortable with endotracheal intubations, central lines, specifically IJ central lines, and ARD sticks, as well as PAP testing in the outpatient setting. But you can see here there are a lot more beyond that we do on a regular basis. And especially those who have some interest in procedures or in focus, the numbers can be robust. One of our graduates last year, for example, who went into pulmonary critical care, did over 200 procedures just on her own in that one academic year. Speaking as somebody who wasn't terribly comfortable with procedures coming into residency, I can assure you that this is something that you will get confident and comfortable with through our program with the support that you need to get you there. A little bit about the Joshua Mack-Simon Primary Care Center. This is where our residency clinic is, and actually where I'm sitting now. Our ambulatory care center has all of the GME clinics on site, so not just the IM clinic, but the pediatrics clinic, the family medicine clinic, the OBGYN clinic, etc. Also on site, we have our in-house pharmacy that provides medications to patients without insurance. We have lab services, social services, interpreters, and POCUS on site as well. Primarily, we do serve underserved or uninsured patients, a lot of immigrant patients, a lot of refugee patients, a lot of patients who don't speak English and would not necessarily be getting care anywhere else. Taking care of that patient population is really one of the things that keeps me in this job and at this institution, because it is so rewarding, not just as an academic and as a learner, but also giving back to this patient population who so desperately needs good care. The ambulatory experience within your clinic experience will primarily be made up of continuity patients that you get to know over the course of your 3 years who identify you as their primary care provider. In addition, during those clinic cheek weeks in PGY1 and PGY2 years, you'll get some acute care opportunities, so things like acute UTI or acute asthma exacerbations, etc. You'll have lots of opportunities to do procedures in our clinic, whether that's joint injections, skin biopsies, etc. We provide educational experiences during your Y weeks. So clinical art discussions happen every Wednesday morning, where a resident will present a recent ambulatory learning article. And then as a senior, you will present an ambulatory case conference to the program about an ambulatory topic. We have lots of QI on campus, as I've mentioned before, and no different in the clinic. A couple of highlights that have come out of that over the last few years include our addiction medicine clinic, as well as our hepatitis C clinic and treatment. This is a not quite complete list of our electives available. And I wanted to highlight the fact that we are constantly adding to this. And if you see something, or rather don't see something that you wish was on here that you'd like to do as a resident, one of my favorite things about our program is how personalizable it is, how we can add electives to it. Most recent example will be lifestyle medicine, which isn't on this list, but is now an optional elective and even a track. And I'll talk about that in a minute. For all of our residents, we have some longitudinal curricula that we cover throughout the course of training. These include POCUS, LGBTQ health, addiction medicine, healthcare disparities, residents as teachers, and patient safety and quality improvement and the curriculum. So you learn about all of these that is integrated into your learning as a resident throughout your training. In addition, we have some optional tracks that people can opt into beyond what is the foundational things. So probably the largest is our primary care track, or PCT as we call it. This can accommodate up to 3 learners per class. So you would match into our program as a categorical resident. And then if you know that you are interested in primary care or interested in a fellowship that is primary care based, you can opt into the primary care track anytime during your intern or second year. We also have a POCUS track for people who are particularly interested in POCUS. We have a clinician educator track, women's health track that really is a subset of the primary care track, patient safety and quality improvement, global health track that includes a trip to Honduras to care for patients in underserved areas, a hospitals track, medical Spanish track, and a new this year lifestyle medicine track. A little bit more about the primary care track. Again, PGY1 curricula is very similar to the categorical, so that the change in the tracks really don't come until the second year. For the PGY 2 and 3 years, you do have fewer ICU rotations, specifically in the second year, rather than having a month of ICU days and a month of ICU nights. You'd have a single month split between the two, all at once. You wouldn't go back and forth between them, but 2 weeks of nights and 2 weeks of days. And then as a third year, you really don't do much ICU at all unless you opt into it, knowing that you are instead doing some additional electives that really prepare you for primary care. So things like rural medicine, dermatology, sports medicine, etc. Again, this is up to 3 per class. Some tracks that don't have caps include the clinician educator track. I think this is a little bit unique to our program, that we offer this certificate program for residents who might want to go into or have an interest in academic medicine. So this involves some extra experience with small group, large group, and bedside teaching, with ability to provide and give adequate assessments and feedback. One of those fun places where you'll get feedback on the feedback you give. You'll get some exposure to developing curricula and for some extra scholarship activities. Our POCUS track, again, is in addition to what our longitudinal POCUS curricula includes for everyone, which is adequate cardiac, lung, vascular, and abdominal exams. So everybody will get experience and learn how to do these basic POCUS exams. But those in the POCUS track will get extra experience with these and others, as well as develop a portfolio where they could go on to teach POCUS to others. This is seems particularly popular for people who are going into procedure or POCUS heavy fellowships, so things like hospitalist medicine, cardiology fellowship, or pulmonary critical care, but again, is open to anyone. Before we move on to research and activity, scholarly activity, I did want to note, I get often asked whether tracks can be combined, whether you could do, say, the POCUS track and the clinician educator track, and the answer is yes, you can do more than one track. All right, moving on to research, scholarly activity, and fellowship. So our research and support for research is robust here on campus. We have a minimum requirements for everyone to do at least one scholarly activity throughout their tenure with us, as well as a quality improvement project throughout your residency. This is just a way so you can get familiar with quality improvement, how to put these projects together, and how to improve care that we provide to our patients before you go on to the next chapter in your career. For research, we have our own IRB, as well as a GME-specific statistician, and also national support from that regard. We have grants available and lots of program support, specifically program funds to support research presentations that do get accepted, where you get to go and travel and present the work that you've been doing. This past year, we had over 56 posters, oral presentations, and publications. This is just a list of all the places, most of the places anyway, that our residents present at. You can see it is across the globe, actually. One of our residents this past year went to London to present her work there. And then below is the list of all of the places that our residents published their work this year. Our scholarly activity also includes things like digital activities, so presenting on the Human Diagnosis podcast. We also have grant applications and acceptances. This was Dr. Deepa Namburi, one of our graduating residents who applied and was approved for a grant last year. We have over 18 quality improvement projects that were completed this past year. Some were wrapped up and some are ongoing. More are being added all the time. And of course, we do have opportunity for regional and national leadership opportunities and advocacy. A lot of these are go through our Indiana and National ACP, ACC, and the Indiana State Medical Association. For fellowships on campus, we have several available. These include the cardiovascular medicine, general medicine, cardiology fellowship, along with an advanced heart failure, transplant, interventional cardiology, and EP. We also have a pulmonary critical care fellowship on site and geriatrics on site. Our fellowship match in the last 3 years has been excellent, something I'm really proud of. We've matched successfully into cardiology, pulmonary critical care, GI, heme, ID, nephrology, and endocrinology. This past year, for what it's worth, pulmonary critical care and cardiology were the two most common, but we did have nephrology as well. And this year, I'm excited. One of our chiefs is going into rheumatology, so I'll get to add that to the list. For more information, again, please check out our website if you haven't already. It has a lot of information and often can answer any lingering questions that you have that we didn't get to answer today. Follow us on Instagram too, if you'd like. You get a little bit of insight and behind the scenes of what our program is like through that lens. We cannot wait to see you again later this interview season and look forward to considering you joining us later in the summer.